Welcome to our fourth and final video. During this series, we have presented the basics of sensory processing. On our first video, you will find a very friendly explanation of our 8 sensory systems. On our second video, we reviewed what is defined as a sensory processing disorder and the different levels of treatments. On our third video, we explained the possible connections between sensory processing disorder and behavior. We are aware that after having this information, you as a caregiver or as an educator have more or new questions. That is why today we will focus trying to answer the most frequently asked questions related to sensory processing disorder. This presentation is possible thanks to TAP and Illinois Extension. The first question is, can someone be diagnosed only with sensory processing disorder? This question is often asked because there is a comorbidity of sensory processing disorder with autism and ADHD. However, a person can be diagnosed only with sensory processing disorder. In the case of autism diagnosis, the statistics have shown that 1 in 56 children are diagnosed with autism. For ADHD, the proportion is 1 in 11 children having been diagnosed. Now for SPD, studies suggest that 1 in 6 children are affected in everyday life activities by sensory processing disorder. In simple words, the numbers are showing that most of the children that have been diagnosed with autism or ADHD will have some level of SPD. But having sensory processing disorder is not an indication of a diagnosis of autism or ADHD. How can I know if my child's behavior is related to sensory processing disorder or autism? Unfortunately, there's no simple answer because the behaviors or responses may be similar, but the cause can be different and sometimes they overlap. However, the most common misdiagnosis is made between sensory processing disorder and ADHD. For example, mistaking hyperactivity on children who are seekers for proprioceptive stimuli. A good diagnosis made by a qualified professional is key. Neurologists, psychologists, and occupational therapists trained in sensory integration can conduct interdisciplinary work to understand the reasons behind the behavior and support with proper intervention. When this doesn't happen, we are not only putting at risk the well-being of our kids, but also we could be medicalizing a behavior that could be addressed with therapy and environmental modifications. The opposite situation can also happen. Can children grow out of sensory processing disorder without a treatment? The answer is no. The adult either learns strategies to cope with it or compensates affecting other aspects of their lives. When a person has sensory processing disorder, their outcomes as adults are going to depend on how well their needs were met as children. If a child grows in an environment where the adult in charge tries to understand and creates alternatives instead of controlling the sensory responses, the child will learn as an adult to self-advocate, setting boundaries and accommodating sensory stimuli to their individual needs. If sensory processing disorder is not addressed, then the person as an adult can suffer from low self-esteem, isolation, anxiety, depression, because our sensory systems are involved in every activity in our lives. So it can affect our occupation, relationship with others, and with ourselves. Can I be diagnosed with sensory processing disorder as an adult? Yes. Unfortunately, sensory processing disorder is not as well known as other diagnoses such as ADHD. So it's hard for adults to get a diagnosis on SPD, but you definitely can and you should ask for help if you identify some under responses or over responses related to sensory stimuli. A good diagnosis can help the adult to identify strategies to increase or decrease the intensity of sensory information and how to manage situations in different scenarios. Generally, individuals who are learning about their child being diagnosed with SPD start recognizing similar signs on themselves and reach out for professional advice to support their own needs as adults, and also learn how to navigate the dynamic when in one household there's more than one person with sensory differences and preferences. Can a person be hyposensitive and hypersensitive at the same time? Yes, our 8 sensory systems work independently. So a person can be hyposensitive for one sensory information and hypersensitive for others. Ideally, the treatment and strategies will focus on responses and behaviors that are interfering with the person's well-being. One example will be having a child that has auditory overresponse, creating avoiding behaviors related to sound or loud environments. And at the same time, the same child can be under-responsive to proprioceptive input. In that case, that child will really enjoy and benefit from physical activity like going to a trampoline park. But it could be difficult to manage the auditory stimuli. In that case, we can find a way to accommodate by going to the facility when we know that there is less public, or using noise cancellation earmuffs. That way, the child will avoid auditory overload and will be able to enjoy a fun and recreational activity. What should I do if I suspect that me or my child have sensory processing disorder? SPD is not recognized as a medical condition, and the diagnosis will not guarantee special accommodations. But having an accurate diagnosis can help you learning strategies and coping skills to navigate the challenges. If you have recognized yourself or your child on the examples and descriptions of our previous videos, it is a good idea to start searching for professional help in your local area. We will wrap up this series by highlighting a few important concepts. First, acknowledging that we all have sensory preferences, and in the case of people with SPD, we must support them, but also validate their ways to read the world through their senses. Also, understanding that in early stages, a child with SPD oftentimes will not have the cognitive skills to connect their sensory overload or lack of stimuli with their emotions. So we as adults have the responsibility to guide them on the development of self-awareness, so they can then identify when and what kind of activities, environments, movement they should avoid or actively seek for. As our final and one of the most important facts is that as caregivers and educators, you must be compassionate with yourselves, because everyday challenges associated with caring and supporting someone can be easily a burnout. Seeking professional advice and emotional support is fundamental for a better quality of life, and it will benefit you and the person you are taking care of. Remember to reach out for support in your local area and check out our website for more content and monthly activities on other important topics.